Hello there, I'm Dr. Chaitra. I'm a breast surgeon and oncologist. Welcome to Breast Health India. In today's video, I will be talking about fibroadenomas. A fibroadenoma is a benign breast condition in which a lump is often felt in a breast, and this lump is usually smooth to touch and rolls underneath the fingers. Very rarely is the lump associated with tenderness or pain. Fibroadenomas are usually seen in young women, but they can occur in women of any age, and very, very rarely they can occur in men too. There are different types of fibroadenomas. There's simple fibroadenoma, and there are complex fibroadenomas, which occur in about 15% of women who have fibroadenomas. These complex fibroadenomas can harbor atypical tissues, that is, tissues with abnormal looking cells. And people who have complex fibroadenomas have a slightly higher risk of developing breast cancer in the future. There can be fibroadenomas which exceed the size of 5 centimeters, and these are called giant fibroadenomas. These, when they occur in teenage girls, are called juvenile fibroadenomas. Fibroadenomas are diagnosed by triple assessment, that is, using 3 methods of diagnosis. The first one being physical examination of the breast by a surgeon. The second one is imaging by a radiologist. And the third one is using a core needle biopsy for histopathology. A core needle biopsy is often the confirmatory test in diagnosing a fibroadenoma and is more accurate than physical examination or a radiological assessment. Occasionally, when core needle biopsy facilities are not available or are not affordable, a fine needle aspiration cytology can be done. In women who are under 25 years of age, a core needle biopsy is not necessary if the fibroadenoma meets Stavros criteria on an ultrasound scan, which will be determined by a radiologist when the scan is performed. In 98% of the cases, a fibroadenoma can be diagnosed with certainty, and in 2% of cases, a fibroadenoma might need to be excised completely to differentiate it from a benign phyllodes tumor. Around 30% of fibroadenomas resolve spontaneously or reduce in size over time, and this usually happens in fibroadenomas which are smaller in size. It is often recommended to excise a fibroadenoma if it crosses the size of 4 or 5 centimeters, or if it shows any rapid growth. The surgery for fibroadenoma is usually done very easily and often can be performed using local anesthesia, especially if the size is not large and a remote incision is not used. However, when a remote incision is used, sometimes a general anesthesia might be required. Keeping the scar under the breast or at the junction of the areola and the breast skin can help hide the scar of a fibroadenoma and is cosmetically more appealing. Sometimes an axillary incision might also be used depending on the location of the fibroadenoma. A vacuum-assisted excision for fibroadenomas which are not too superficial can also be done instead of surgery. Not all patients who have a fibroadenoma would need surgery. Only those who wish to have surgery for personal reasons, those with rapidly growing fibroadenomas, those with large fibroadenomas, and those with complex fibroadenomas or fibroadenomas harboring any suspicious tissue, or those with a diagnosis unconfirmed by core needle biopsy would be requiring excision either through surgery or vacuum assisted excision. I hope this video has been useful to you. Please do not refuse a core needle biopsy on a fibroadenoma. If, due to financial restraints, a core needle biopsy cannot be performed, please proceed with getting a final aspiration cytology done, as it helps complete triple assessment and will aid in confirming the diagnosis. There is always a risk of missing cancers if triple assessment is not completed, and let's not make that mistake. Thank you.